Hi, Dr. Todd Sullivan from Nova Chiropractic and Acupuncture. In today's video, I'm going to go over the most frequently asked questions by patients. One of the most common questions I get asked by patients or potential patients is, how do I know I need to see a chiropractor? So chiropractors deal with musculoskeletal issues, often dealing with the spine, but it could also be in the extremities. So my office, we treat pretty much head to toe, treat a lot of sports injuries, so any lower body or upper body injuries as well. So if you're dealing with any issue in the spine, definitely a chiropractor would be appropriate. We're going to be the most conservative care along with physical therapists. And then there would be like physiatrists, which are more of like pain management doctors. And then last but not least are going to be more aggressive like orthopedic or surgeons like that. So a chiropractor will deal with issues commonly dealing with the spine. Your issues may be dull or achy kind of pain, or it may be more of a sharp shooting or even a numbness or tingling feeling, but all of those are still going to be issues that a chiropractor can deal with. Or if we can't, we're going to refer you out to somebody that can. A chiropractor, again, can deal often with like knee injuries, ankle, plantar fasciitis, shoulder injuries are very common. Many times patients come in and we treat them from one issue and they find out really that we can treat a lot of different issues, and so they don't realize that we treat more than just the spine. So depending on the chiropractor, it'd be good to ask what they treat and what their certifications are, because that can allow them to treat more areas besides just the spine. So a chiropractor can often deal with any kind of musculoskeletal issue dealing with the spine or throughout the body. Another common question I get from patients is, what is going to happen on my first visit? So what's going to happen is you can schedule online on our website, novachirowellness.com, and you can pick a time that works well for your schedule, or you can call the office at 703-912-7822. And once we get you on the schedule, we're going to have you fill out the paperwork online. It's a really streamlined process. You'll fill out your paperwork online. You can put all of your insurance information on the online paperwork. And then what that does is it gets downloaded into your electronic health records. And what we can do is ahead of time, we'll call your insurance company, verify your benefits. I will review your intake form, what your main issue is. And then when you come in, we'll have some other forms for you to read over and sign. And what we'll do is I will take the patient back into the exam room. We'll sit down, we'll discuss their issue, discuss what their goals are, because a lot of times patients do want to obviously get out of pain, but it may be more than that. It may be, I want to run more, I want to exercise without discomfort, I want to play with my grandkids without pain. So defining your personal goals is key, because it may just be beyond more than pain relief, and we can address those issues. Then once we discuss your complaint, then we're going to do a comprehensive examination where we're going to examine not only the area that is bothering you, but often areas above and below that region as well, to assess those areas and to check out kind of the whole body as a system. And that may involve checking range of motion, checking different orthopedic tests that we can do during a neurological exam, and then ultimately figuring out what is causing your source of your pain, because sometimes it can be the actual location where you're having pain, or it can be a pain that is being referred to that area or radiating from another area, and we can address that. So once we figure out what is going on, then what we can do is I will build a comprehensive treatment plan to get you out of pain and get you feeling better, and then to achieve those goals that we had talked about in the beginning. Once we build the treatment plan out for the patient, and this is all done on the first visit, what we're going to do is I'm going to discuss what our treatment options are. Then what we're going to do is we're going to proceed with the treatment. We often do, I would say 80-90% of the time, we will do treatment on the first visit, because our goal is get you out of pain, get you feeling better, get you moving better, and again, striving towards those ultimate goals that you want to achieve. So that's typically what happens on our first visit. If need be, if I do think an MRI or an X-ray is needed, we will refer you to an imaging center to get that completed. But I would say 80-90% of the time, we do not have to do that right off the bat, and we can actually get started with the treatment right then and there. So I hope that answers a common question of what happens typically during your first visit at a chiropractor. Another common question I get from patients is, how often do I need to see a chiropractor? So it can vary depending on the condition, but typically I like to see a patient anywhere from twice a week. Maybe if they're really acute, we will see them 3 times in a week. And typically we'll do that for 2 to 3 weeks, maybe 4 weeks at the most. But anywhere from that 4 to 8 visit range is very common for most conditions. Some chronic issues will definitely take longer, maybe up to 12 visits or even more, but for the average acute injury, anywhere from 4 to 8 visits will relieve the pain and get them feeling better. And then again, talking about what your ultimate goals are, we may continue care or we may discharge you if we've already met those goals. But that's a common treatment plan, is twice a week for 3 to 4 weeks, and usually we get the patient feeling much better. If after 4 to 6 visits we are not seeing the changes we want to see, typically I will either refer the patient out for imaging or I will refer them to another provider if I don't think I can help them. Another common question or statement I've heard from patients is, oh, I've heard that once you see a chiropractor, you have to see a chiropractor for the rest of your life. That is completely incorrect. I would say, again, we just talked about what my common treatment plan is. Typically, I will see a patient anywhere from 6 to 8 treatments, and then we will discharge them from care and give them recommendations for exercises they can do at home to prevent future injuries. But there are some conditions that are more chronic in nature, say like arthritis, where we're going to get the patient out of pain, get them feeling better, but they may need to come in for some kind of routine maintenance to decrease their pain, because we're not ultimately going to remove the arthritis. We're going to definitely provide relief, get them feeling better, but they may need to come in for a follow-up. But often that is often left up to the patient. I often will say, let's see how you do. Give me a call if you have a flare-up again. And a lot of times what patients find out is they were getting a lot of relief here, and they maybe went a month or 2 and they had another flare-up, and they'll come in. I'll treat them 1 or 2 times, get them out of pain, and then they often go through this cycle where they'll go a few months, get a re-aggravation. And so patients often come to realize, hey, if I see Dr. Sullivan once a month or once every couple months, it's going to keep me feeling good without pain, and I can move better. And so that's how a lot of times patients will continue care once we get them out of that acute situation and get them feeling better. By no means do we require any patients to sign up for any long-term care. It's totally up to the patient to decide what they want to do and how we want to approach things. So I hope that answers a common myth that you hear, that you have to see a chiropractor the rest of your life once you start to see one. That's totally incorrect. And again, it's more about what the patient wants and what their goals are, and we try to provide that for the patient. Another common question I get from patients is, what is the popping or clicking noise I hear during a chiropractic adjustment? So what will happen when the joint is restricted and not moving correctly or out of alignment? There'll be a lot of pressure that builds up in that joint. And so inside of our joints, we have synovial fluid. And when that joint becomes restricted or not moving properly, you can get a gas bubble that will build up in that joint fluid. And so when we do provide the chiropractic adjustment and restore that range of motion, a lot of times you hear a pop or a click. And what that is just a release of a gas bubble inside that joint fluid. It's not painful. It doesn't hurt the joint. It's very safe for the joint. Actually, it helps to restore that motion, which will help to reduce further strain and stress on that joint and get it moving better. It's definitely not a bone cracking or anything like that common myth that you hear. It's actually a good thing for the joint, restoring that range of motion and getting it moving better. So those are the most frequently asked questions I get from patients. If you have any questions, reach out to me at 703-912-7822, or you can schedule online at novachirowellness.com.